Intermittent Fasting 101. Part 1. Fasting has been practiced by religions and spiritual practitioners for millennia. It is known to have health benefits for the mind, body and some say, soul. In the video we'll look at a variation, intermittent fasting. If you are new, then Intermittent Fasting 101 will help you get started and give you all you need to know. You will learn what intermittent fasting is. You will also learn what you should be careful of and what to expect when you start. Intermittent fasting is a way of eating where you do not eat for set periods of time and then have a window where you can eat. Its focus is not what you eat, but when and how often you eat. That does not mean it is an excuse to eat anything you want. You are still better off eating a whole food healthy diet. It's not just beneficial for fat loss and avoiding weight gain, as most people think. It also has a positive effect on your hormones, your relationship with food and many other things. It's a great addition to a healthy lifestyle. Intermittent fasting mimics the natural way our ancestors ate. They did not have abundant, always available food like we do today. There were days and weeks that they were not able to get a lot of calories and other days where calories were abundant. They also had to deal with the seasonal nature of food. So they adapted to deal with food scarcity. This adaptation allowed them to thrive even without constant calories and nutrition-dense food supply. In fact, their bodies would respond in positive ways when they did not eat. We have the opposite issue. We live in times of ready available calorie-dense food supply. However, our bodies are still using the same operating system as our ancestors. Because we are always eating, we never give our body a chance to burn fat that it has stored. Many of our physical and mental problems come from this unnatural fit of our bodies with this relatively new environment in our history. Intermittent Fasting 101 Guide to the different fasting methods. Keep in mind, there isn't a perfect way to do intermittent fasting. It depends on your lifestyle, family life, your genetics and relationship with food. This guide will help you decide which method suits you. Some people do better without breakfast, others cannot start the day without it. You can use things like this to your advantage when deciding which eating periods to choose. Let's have a look at the common intermittent fasting methods. 16-8 method, the Lean Gains protocol. This involves a fasting period of 16 hours each day, then eating all your meals within an 8-hour window. For example, you might eat between 12 p.m. and 8 p.m. and fast from 8 p.m. to 12 p.m. the next day. This is a good method if you like your meals spread out and cannot wolf down a lot of food in one go, as you have 8 hours to consume it. It's good for beginners, as most of your fasting happens when you are asleep. So it takes less discipline. It's also good if you already do not eat breakfast. You are much more likely to stick with it because it fits into your current routine. 5-2 diet, the fast diet. With this method, you follow your usual eating habits for 5 days a week, and on 2 non-consecutive days, you cut back your calorie intake to between 500 and 600 calories. This one can be more challenging if you are not used to fasting, as it requires a full day of very low calories. I find it easier not to eat at all than have a low number of calories, as the small amount of food ignites hunger. But it depends on your psychological makeup. You might be okay with it, knowing you can go back to eating normal the next day. If your daily hunger is not consistent, with some days where you are not very hungry, this method could work for you. Eat Stop.Eat. This entails fasting for 24 hours once or twice every week. For instance, refraining from eating between dinner on one day and dinner on the following day. This is how I started my intermittent fasting journey. I did this once a week. The first time I did it, it was difficult, more for the psychological aspects than the physical hunger. Once you get used to it, it is not difficult. You will see your hunger comes and goes during the day. You will also realize how much more time you have when you are not cooking or eating. Get a good book or a movie, otherwise, the extra time might hang heavy for you. Alternate day fasting. With this method, you alternate days of normal eating with days where you either fast or consume a very minimal amount of calories, usually around 500 calories. This can be one of the more difficult methods as you do not have more than one day in a row where you eat normal calories. On this method, people are more likely to have compensatory hunger. This means the day after the fast, they eat a lot more and also eat less healthy food to make up for the previous day. Studies have shown people stick to this method less than others. The warrior diet, aka 20-4 method. Ori Hofmeckler came up with this diet. It involves eating small amounts of raw fruits, vegetables or grass-fed whey protein during the day and eating one large meal at night. Effectively fasting all day and feasting at night within a 4-hour eating period. After the one full day fast a week, this is the next one I tried. Although I have modified my intermittent fasting over the years, this was the one that I did for a long period of time. And was the first time I learned about intermittent fasting from Ori's book The Warrior Diet. In terms of difficulty, I found it similar to the 16-8 method. As it allows whey protein, it is suitable for people who weight train and do not want to lose as much muscle as the other methods. You can also do this method without eating anything during the 20 hours fasting period. Intermittent fasting safety precautions. Make sure you drink plenty of water. Black tea and coffee are okay as well. They will also help you deal with the hunger, especially the coffee. As with any drastic changes that affect your health, consult your doctor before you start. Be especially careful if you have any of the following issues. 1. If you are trying to conceive or have a history of amenorrhea. 2. If you are pregnant or breastfeeding. 3. If you have diabetes or difficulties regulating blood sugar. 4. If you're taking medications, it's important to discuss with your healthcare provider before making any changes. 5. People who are underweight or have a history of eating disorders. 6. If you have low blood pressure. 7. Children should not do intermittent fasting. How to get started with intermittent fasting. The best way to get started is to pick a method that you are most likely to stick to and fits in with your mindset and lifestyle. If you do not eat breakfast anyway, then going for the 16-8 method is a no-brainer. Start slowly if it helps. For instance, you can do the 16-8 method once in the first week and build slowly as you want from there. You can also play around with the methods. Do a 16-8 one day, then a full 24-hour fast another day. Just don't make it too complicated. I do mostly 16-8 and then occasionally add a 24-hour fast. Thank you for watching. In part 2 we will look at the benefits of intermittent fasting and answer some common questions people have.